Life lost to the invisible killer represents a tragedy. And we now know that no one is completely safe. While most of those it claims are the elderly and the vulnerable, Mohammed Mutlib today told us about his family friend Ismail, just 13 when it took him.
There were no underlying symptoms, there were no underlying illnesses that could have even made anyone suspect that he's in real danger.
Ismail Mohammed Abdul Wahad's large family in South London today described him as a loving son, brother and nephew, saying his smile was heartwarming and he was always gentle and kind. But tragically, the family weren't able to say goodbye to him.
No one else is allowed to be around that individual, and that means you're on your deathbed in your last moments alone. And he was a young boy, age 13, without his mother, without any sibling on his deathbed in the last moments. And that's very hard to sort of digest and really understand as to how lonely and how sad that moment must have been.
20 years a nurse at Goodmayes Hospital in the capital, Thomas Harvey died after contracting the virus.
My dad was a really selfless person. He always put others before himself.
A devoted father of 7, he told his family about his concern at the level of protective equipment.
He expressed to my mum that they had a lack of PPE and that they had flimsy aprons and just flimsy gloves. It was a case of that he just didn't feel protected and he didn't feel safe on the ward.
Just as sad and worrying in its own way is the death of Doreen Hunt, mother, grandmother and great-grandmother, who because of her kidney condition followed all the guidance.
My mum was careful. She was isolating for weeks before this happened. She was using all the sanitisers because she was on home dialysis. So she was extra careful, and yet still, somewhere, somehow, she's picked it up.
Every day brings more death and more heartbroken families, underlining how much we have left to learn about the killer in our midst. Paul Davis, ITV News.